Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years and now doing the dental practice brokerage for 15 years. Today's topic: what is the one characteristic when buying a dental office that turns off the seller and his staff or her staff? We can get into that. Before we do, as you know, we now have 10 employees. We're in 25 states and we're available to you 363 days a year, taking off Christmas and Easter. You can reach us at 201-663-0935. Our website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. Just call us. We'll be happy to talk to you. And if you want some free advice, we can talk to you too. Again, everything you're about to hear is for entertainment purposes. It's not legal advice. Now, if you have the large practice and you're thinking about selling to the DSO, call us because we work with them all the time. We're not employed by them, but they will often pay our commission, and it works out great. You get our expertise, and we know who's having trouble and not. For example, I'm going to the DSO convention this week in July or August. It is DICOMA convention. There's be a ton of DSOs there, and we talk to them, we communicate them. It'll be a good networking event. So we kind of know what's going on, the inside track. All right, now, so there'll be generally no commission to you, so give it a try. Secondly, if your practice is going to sell for over $1 million, the practice portion, will often reimburse at successful closing your legal fees based on some minor criteria. So give that a try. So let's get into what is the one characteristic that absolutely will turn off the seller of a dental practice and turn off the staff, and the staff may leave you. What is the one characteristic? Hold on, I'm at an intersection here. Thank you for being patient. Always be careful at intersections with cell phones. So, the one characteristic is the hot shot. The doctor that knows everything. That is the smartest guy in the room. This just happened. I brought the doctor to meet the seller. Staff were not there. Generally, we don't tell staff we're selling. And the seller just did not feel good. He says, I don't feel right about this, doctor. The doctor was like super confident, smartest guy in the room, knew everything. That's a little dangerous sometimes. You don't want to do that. And this doctor, that was the story. They knew everything, and they were the smartest person in the room. And the seller, I could tell, was getting turned off. Secondly, if you have a situation where the staff knows the doctor's going to sell, and the buying doctor meets the staff ahead of time. We generally don't do that, but under circumstances, and meets the doctor, they are going to render an opinion. Now, sometimes they're a little too tough on the doctor. It is a younger person. They have a little more confidence in themselves. But they will give a signal to the selling doctor. They don't know if they're going to be comfortable with this new dentist. They just start shaking their head. That may kill the deal. Remember, a lot of these staff have been with the doctor all their life, and they become close, all of them. He wants to take care of them, put them in good hands, and also their patients, his patients or her patients. You don't want to come on too strong. Don't want to be the most smartest person in the room. Don't want to be too cocky. I'm telling you this attitude because it just happened. This attitude will kill your opportunity and your deal. Has nothing to do with the cash flow or the amount of money you're offering. And obviously, they're expecting you to offer a fair amount of, like say a number that they're comfortable with, you're comfortable with. Amicable resolution on that, whatever's in the contract. So assuming that's the same with any buyer, just assuming for a moment, they're always going to choose the person they're more comfortable with. Now, this just happened, and I've mentioned this before in some of my other tapes, so you got to just mention that. Please hit the subscribe button, and we are all set. Thank you.